Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. We often see patients with the shortening, and these shortening can be congenital or they can be because of some trauma. Now, these shortening can be mild, and they can be average, or they can be severe. Now, these shortening are sometimes true and they are sometimes false. True means that if there's really missing part of the body, like some fracture, some missing part of the bones in the femur, in the tibia, that cause the true shortening. In some cases, we don't have true shortening. We have pelvic obliquity, we have pelvic asymmetry, we have pelvic tiltation, and sometimes we have scoliosis. So apparently that shows us that there is a leg length discrepancy, which is not the case. So in these cases, we should not compensate fully. We always compensate half. That means if 4 centimeter is false shortening, we go for 2 centimeter. Now, these shortenings, when they are true, then we never compensate them to the full extent in the first stage. For example, if the patient has a 5 centimeter shortening, we go for 3 centimeter shortening for a month, and then we gradually add one more next month, and then maybe next month 1 more centimeter. So this gradual approach helps the patient to adapt to the pressure which he is having from the raise, and the whole biomechanical system which has been changed because of the raise is accepted by the patient easily without having pain or discomfort. So this approach applies on children as well as on adults. And when we compensate, then we must keep one thing in mind, that stability remains the top priority in all these compensation and build-ups which we have for the patient. So if the build-up is like a very low level, like a centimeter, then we mostly go for the equinus raise, like this one, or sometimes we go for the silicone one. It's also compensate for 1 centimeter. Now this 1 centimeter can be put in any ordinary shoe inside comfortably. So raise and shock absorption. The same, this is a compact one. It can be put inside this shoe and the patient can walk easily. Now if the compensation is required more than centimeter, then we need shoes which are more spacious for equinus raise, and they are a little wider. That means foot should not be cramped or squeezed inside the shoe. So we have a raise which is equinus. You can see that easily, around 1.5 to 2 centimeters, or we have a raise which is almost like a 3 centimeter. The more we go for the raise, the better is that we keep the foot balanced. So that means you can always have a insole attached with the raise. That means the foot is more stable. So then these equinus raise can be put inside the shoes easily, provided the ankle part is more higher, like this one. We need more higher ankle part, so the foot should not flip out from the shoe. It should remain stable throughout the gait cycle. Geriatric people, they don't accept high ankle easily, so in those cases you have to be very careful not to put a very high equinus raise. In other case, when the raise is like too much, then we can distribute the raise in sole raise and the equinus raise. So this is a sole raise. You can see that it has been put to the sole only, stuck outside. It is very stable. Cosmetically maybe not acceptable to some patient, but it's extremely stable. It has no impact on the rest of the joint on the same side. Equinus raise, when we put, it can change the biomechanics of the lower limb, and that can have certainly negative impact on some joint, and as a result the patient can have pain or discomfort because of the equinus raise. But the sole raise are normally very comfortable, although a little heavier and stiff because of the material. They are normally very stiff, but they are very stable. The joint very safe from any sort of pressure, and some patients they don't prefer like the whole raise outside. then in these cases we have a combination of sole raise and the equinus raise. So that means 5 centimeter shortening we can put 3 centimeter outside, and we can have 2 centimeter equinus raise like this one, which can go inside. That means altogether now we have 5 centimeters. It is more acceptable cosmetically and also stable in this particular case. Now, apart from the shoes, sometimes we have for ladies in particular, we mostly go for the equinus raise, like in this kind of slippers, and these are highly adjustable. And then when you build the raise, you put it inside. The shoe looks very normal from outside, and then this part we cover with the identical material and colors, so cosmetically is very much acceptable to patient, and this seems quite stable too. Now, when we make orthotics, then sometimes we also have the same issue. Now, in this particular case, this child has a 3 centimeter shortening. So instead of putting it inside make it very smooth, comfortable, and with a nice grip. So we put all the 3 centimeter outside, so it is stuck outside. That means that it can be put inside like this sandal easily, so without showing anything, nicely, and it looks very normal, and the child can walk in this easily. So now these compensations are basically designed from case to case, and you have to evaluate cases before you decide what you need to manufacture for this patient. But keeping in mind that cosmetic appearance should be acceptable, and not to compromise on the function, but sometimes to have an approach to improve the function gradually, not from the very first stage, which can be an issue to the patient. Thank you very much.